right, good evening to the people of Nevis, those in St. Kitts, those in the wider Caribbean. Good evening to all of our friends and family in the United States and Canada and the United Kingdom. Wherever you are, good evening and welcome to another edition of On the Mark. Let me start out by thanking the Honorable Alexis Jeffers, our Deputy Premier, the Honorable Eric Evelyn, and the Honorable Troy Liburd, all of whom would have hosted the show in my absence. As the public would be aware, I spent some time in New York attending the 76th session of the United Nations General Assembly, and of course, as foreign ministers would do, dealt with a number of meetings and engagements around the Assembly, or as we would refer to it, in the margins of UNGA 76. I'm very happy to say that that trip was successful, and I'm happy that we yielded some positive results for the Federation of St. Kitts and Nevis. I'm back now. I had to do 4 days in quarantine and thereafter, of course, got back to work. And so I'm delighted to be here with you this evening and to spend the next 2 hours with you discussing matters that are of importance. Now, at the top of the hour, let me tell you that tonight is a very special show. We have at 8:30 a call-in from Dr. Charlie Rouse, who is calling from the state of Georgia in the United States. Dr. Rouse, through his Rouse Foundation, is no stranger to St. Kitts and Nevis. He has done an incredible amount of work here, working particularly with NCDs, non-communicable diseases. And he will be calling in tonight to have a very special conversation on the whole issue of vaccination and to give us a perspective, not only from a medical perspective, but also from a real practical perspective as to what is happening in the state of Georgia and what he and his team have been able to accomplish there, which interestingly has had similar issues and similar concerns expressed, particularly in the African American community, as we have had here. I would want to thank my dear friend Ursula, who, through her mom of blessed memory, would have introduced Dr. Rouse to Nevis, and we welcome Dr. Rouse and his family as a part of our own family here on the island of Nevis, and look forward certainly to the conversation, which we hope will start at 8:30. Ursula, Dr. Rouse, if you're listening, the number to call at 8:30 would be 869-469-1616 or 869-469-1700. So we will wait for your call then and start that conversation with you. At the top of the show, let me, of course, indicate that we have had some unfortunate deaths and tragedies on the island in terms of some of our people passing on. I know that there are quite a few families that are mourning, and I would have mentioned some in my press conference today, the monthly Premier's press conference. I would want to thank the media that turned out and for all the media houses that carried the press conference. But tonight I want to remember one person in particular, and that is Mr. Liburd, whom all of us knew as Boops. I remember him in particular because he was known to all of us. He was always right there at the gap, as we call it, there at Coal Hill, where Coal Hill meets the Island Main Road. And he would have had an illness and would have suffered for some time and would have passed on. But what I think is particularly tragic is he passed on just 2 days after his sister was laid to rest. Mrs. Liburd was laid to rest, and so it's a very sad situation, and my heart goes out to his family, particularly my dear friend Magri, but all the family members as well, who have only just laid their mother to rest and now have to contend with laying their uncle to rest as well. So please accept our condolences, and please know that our prayers are with you, and we pray that the prayers of the multitude will comfort you in your hour of bereavement. For any and all others that are down, that are struggling, that are bereaved, we also express our condolences to you as well. A lot has been happening here on the island, I think, in the situation in the context of COVID. Just to give some numbers, we'll get into those a bit later, but the latest numbers that we have on the island of Nevis, we've had 12 new cases just yesterday. 12 new cases just yesterday. We now have 107 active cases, 271 recovered cases. We have 4 persons in hospital. We have had, unfortunately, 2 people paying the ultimate price of death to COVID. And we have thus far in Nevis had 380 total confirmed cases. In my respectful view, that's 380 cases too many. we've had 380 cases, and we continue to urge our people to go out and get vaccinated. The latest statistics we have as of October 5th on Nevis is that 63% of our adult population have taken the vaccine. First dose is at 5,833, and the second dose 5,426. So there's a gap there of about 400 persons who need to go in and get their second shot. Now that we've introduced the Pfizer, FDA-approved Pfizer vaccine, we have just 3% of persons have taken that. We have thus far 109 persons have taken the first dose and 41 have taken a second dose of Nevis. Of our entire population of 12,277 persons, we are at 45% fully vaccinated. So when we put everybody together, of the adult population, we are at 63% fully vaccinated. Let me just point out the statistics nationally. The statistics nationally, as of Tuesday, yesterday, we had 61 new cases. That looks like a record in terms of new cases in one day. Total cases thus far, 2,246. We have 1,073 active cases, recovered 1,157. On cases, number of cases in St. Kitts, 1,866, and on Nevis, as I said, 380. We have, regrettably, 16 deaths so far, 14 on St. Kitts and 2 on Nevis. When we look at the vaccination position nationally, we are now at 76.3% of our adult population. They have taken the first dose. Our adult population is 68.6% fully vaccinated. And insofar as our children are concerned, 12 and over, who can take the Pfizer vaccine, we are nationally at 9.1% have taken the first dose and 3.7% have taken both doses. So we have administered thus far a total of 48,499 doses, and we have thus far 22,670 persons, representing 68.6% of our population fully vaxxed. Now, if you recognize that the overall federal statistic is 68.6% fully vaxxed, and that for Nevis is 63%, then you immediately recognize that Nevis is lagging behind St. Kitts insofar as the vaccination is concerned. And that is part of the reason why this evening we have collaborated with Dr. Rouse to have a candid conversation to get the experiences from there in the state of Georgia and to find out what they're doing in the United States, and more specifically in the state of Georgia, to persuade people that vaccination is in fact the answer, and it is only through vaccination that we will be able to move forward in relation to this pandemic and the fight. I continue to say and to maintain that the vaccine provides the very best safeguard that we have, the very best weapon that we have against COVID-19. Tonight, and this brings me some joy because we have been agitating for some time. Clearly in a cabinet you have different views, but I have been consistent in my position, and I believe that others who have been consistent in this position, tonight we can announce that our protocols have been revised and that the new SRNO that will go into effect as of 5:01 a.m. tomorrow, Thursday, is that now if you're fully vaccinated and you are entering St. Christopher and Nevis, if you're fully vaccinated coming in, whether you are a national, a returning resident, or you are a tourist, a visitor coming in, once you're fully vaccinated, you will be required to get a PCR test 72 hours prior to your arrival, within 72 hours prior to your arrival. And once you arrive fully vaxxed with that negative PCR test, you will be tested within 24 hours and released if you are a negative. Let me say that again. Once you arrive fully vaccinated with your negative PCR test, you will be tested within 24 hours of your arrival, and once you test negative, you will be released to go about your business. So we had quarantine for 14 days. We took it down to 9 days, then we took it to 4 days. Well, we've now effectively removed it and have said that persons now will have to test once they arrive and be released within 24 hours. So if you arrive at 3 in the afternoon and your test can be administered, we're hopeful that the hotels and all of those will get the protocols going so that they can test at their hotels, that once a test can be administered and the result be back within a few hours, you're released once you get that negative result. So that is, I think, a giant leap forward for St. Kitts and Nevis, and puts us now on par with what is going on in places like Barbados and elsewhere. So basically, it's arrival, test, and release. Within 24 hours, you must test. So there's no longer a situation, as I encountered when I came back, of sitting down for 4 days waiting to take your test, and then, of course, sitting down again and waiting for the results. No. Now, when you arrive, you will test within 24 hours, and if you are negative, you will be released. Of course, if you test positive, then you'll have to go into quarantine. If it is that you arrive, and I want to make this very clear, if you arrive into St. Kitts and Nevis as a returning national or resident, you are unvaccinated, then you will have to do 14 long days in quarantine. So yet another reason why you should get vaxxed, because the vaccinated clearly, statistically, are at a far, far lower risk of contracting, of spreading, of having any serious symptoms of COVID-19. And so if you are fully vaxxed, again, arriving into RLB or Van Zamre Airport, or arriving on a boat, you're fully vaxxed coming in, you've had a PCR test within 72 hours, which is negative, you will be tested within 24 hours and released immediately upon a negative result being obtained. If you are unvaccinated, arriving into St. Kitts and Nevis, you will have to do the whole 14 days. Long, hard labor. So please, go out and get vaccinated and come home to spend Christmas with your family. And those out there who are looking for a place to holiday this Christmas, St. Kitts and Nevis is now truly open for business. Now, it really means that we will have to get our testing right. I said it today and I say it again, that I am very sympathetic to the number of persons who have got caught in quarantine because our testing capacity suffered some difficulties over the past weeks. We in Nevis, of course, have been wholly dependent on labs on St. Kitts because there was no testing capability on Nevis. Well, we have for nearly 2 years depended on NextGen, depended on Avalon, and more latterly depended on the JNF hospital to get tests done for COVID. My government has decided that it is time to change that dependency, and I'm pleased that we now have acquired and in hand the necessary equipment for PCR testing here. We have the necessary lab set up. We have the necessary, something I think they refer to it as a cabinet. I hope I have the language right. And all that we're waiting on now is some training and certification. Why is that necessary? It is necessary that our lab technicians are properly trained. In fact, we've hired additional support in terms of lab technicians. They have to be properly trained, but in addition, the equipment and the testing has to be certified. And certification is critical because remember, once we give you a result, we have to be able to stand behind it. And so with that capability of that PCR machine already received and a second PCR machine that we have ordered through the assistance of the Japanese government, and we say thank you to the government and people of Japan, we will have 2 PCR testing machines available to us on the island of Nevis to augment what is available privately at the private labs and at the JNF in St. Kitts. And so that will put the country in a much better position where even on St. Kitts, if there's a backlog, they can then rely on us here in Nevis and vice versa. But what we anticipate is that will allow the island of Nevis far more flexibility and rapidity of response insofar as PCR testing is concerned. So that when people arrive here, get tested, swabbed, they will get their results back. And within a few hours, we hope, be on their merry way. That is what we want to do. You arrive at 3 o'clock in the afternoon, you get tested, you get your results, you're out for dinner, and of course your first round of golf early the following morning. That is our aim, and so we think that the hoteliers tonight should be quite happy, the restaurant owners should be happy, our taxi drivers should be happy, and we are hopeful that business will now start to flow again and that some sense of normalcy will be restored. Clearly, our numbers are what they are. There will be some who will judge and some who will question and some who will say what if, but we are where we are. I am grateful that our system, our hospital and health system, has not yet been overrun, and I'm prayerful that we never get to that stage. We have lost 16 lives to COVID. One life to COVID was one too many. I said on this program some time ago that COVID had come to kill, and I was attacked in some quarters. They say that as a premier I should not have spoken in such stark language. But sometimes you have to tell people just the way it is. And those who know me know that I have made a life of being a plain speaker in public, that I have said to my people what the position is. I have not sought to hide. I am not one known to obfuscate. I have always come and said to you, this is the position, this is my concern, these are the facts. It doesn't get any more transparent than that. And so when I said COVID had come to kill, is because we had the evidence all around us. It had not yet killed anybody here, but I was issuing a warning to our people that if we did not adhere to our protocols, if we did not pay attention, if we did not take the vaccine, then that would be the end result, because COVID didn't come to play cricket. COVID didn't come to say, how you doing, Miss Brown? COVID didn't come to have a cup of tea. COVID didn't come to play dominoes. COVID came to kill. That's what it comes to do. So yes, there was some concern in some quarters, and clearly I have been a lightning rod for criticism at times, and that is fine. But at the end of the day, 16 persons have lost their lives. And we could only wonder what would have happened, and could those 16 persons still have been with us if we had paid greater heed, and all of us would have paid greater heed. We have 4 persons currently in hospital in Nevis. We have more in hospital in St. Kitts. What would have happened if our people would have paid heed? Because the statistics are overwhelming. That the persons who are dying overwhelmingly are the ones who are unvaccinated. The persons who are hospitalized are overwhelmingly the unvaccinated. The persons who are contracting and spreading COVID are overwhelmingly the unvaccinated. I recall when we had 10 deaths. I confess I don't know what the statistic is now that we have had 16. But when we had 10 deaths, of the 10, 9 were unvaccinated. And only 1 was someone who was vaccinated, but who I understand had a tremendous number of underlying conditions. So, that's the reality. That's where the statistics are showing. That's where the statistics are leading. And I believe that it behooves all of us now to put away all of the rhetoric and to state very clearly that we stand with health, we stand with public safety, and we stand with each other. Today I made a comment in my press conference about the politics of the situation, and I continue to be greatly troubled because I made a comparison to Trinidad and Tobago, where the former Prime Minister, now leader of the opposition, Kamala Bissessar, she has been organizing transportation. Her party has been organizing transportation to take people to the vaccination sites. Why? Because she recognizes that people who support her party face the same risks as people that don't support her party, and that the country and the country's economy is in shambles in Trinidad and Tobago because of COVID. So she has been responsible and said, as a leader and the leader of opposition, that is what she will do. In Anguilla, I have seen Cora Richardson Hodge, the leader of the opposition there, going out with the other members of the government and the opposition team together and taking the vaccine on camera so that Anguillans could see that insofar as the political directorate is concerned, the parliament is concerned, they are all together and singing same church, same pew, same hymn book, singing the same hymn. How great thou art. That is what they're doing. I jump over to St. Lucia. In St. Lucia now, Prime Minister Philip Pear I was very pleased to find a YouTube video of him when he was leader of the opposition, leading his entire opposition team into a clinic on camera to get vaccinated and exhorting the St. Lucian people to go out and get vaccinated. You know why? Philip Pear understood that when you're leader of the opposition, you are the next prime minister in waiting, so to speak. You are the alternative. And look what happened in St. Lucia. The people went to the polls and the people threw out Alan Chastanet and elected Philip Pear. Philip Pear now is standing on very good ground because all he now has to do is continue the same message, because he was in opposition being responsible and saying to people, go and get vaccinated. Matter of fact, I am getting vaccinated. My team is getting vaccinated. The Labour Party in St. Lucia stands with the government in getting vaccinated. Look at things now. Philip is now Prime Minister. Now, could you have imagined if he had taken a position that was anti-vax, or as we see happening here in St. Kitts and Nevis, and more specifically on Nevis? Me no know. Me not tell you what to do. It's up to you. You can vax if you want. You can decide you're not doing it. That's your private choice. That's your business. That's not leadership. Let's jump and go to Jamaica. I saw a video where Christopher Tufton, the Minister of Health in Jamaica, sat down with his counterpart in the PNP opposition, and together they gave a joint press conference, government and opposition together, telling the people of Jamaica, vaccinate. Let us help each other get out of this calamity in which we have found ourselves. Let me ask you a question. Do we know if any member of the political directorate in the opposition in Nevis is vaccinated? Do we know? Has any one of them come to the public and said, listen, I'm vaccinated, it is safe, nothing has happened to me, and I'm encouraging you to do the same? Have we seen any of them come out and advocate that our people get vaccinated? And let me take it one step further. If tomorrow we were to have an election here, and by some miracle those currently in opposition were to get into government, will COVID go away? Will the need for vaccination become any less because a different party is now running the island? Obviously not. The problem of COVID is not a political problem. And so I continue to say to all of us in leadership, whether you're in leadership in the church, you're in leadership in your place of business, you're in leadership in the community, you're in leadership in the schools, you're in leadership in politics, let us stop playing the fool with people's lives and livelihoods. Every day people say to me, you are the government, what are you doing to create jobs? Well, yes, we are the government. But how can we create jobs when so many of the sectors need certainty and need people to be safe in order to reopen fully? The tourism sector needs it desperately. That's what we have now tried to do with the new regs, to say test within 24 hours and released. But other sectors of the local economy need it as well. It cannot be right, as you try to restart an economy and regain the momentum that we had, that government departments, various offices and various businesses continue to see positive cases and then have to shut down. Contact tracing has to happen. People that infected person came into contact with have to stay home. Families have to stay home. They all have to be tested. They have to wait for the test results. You know how much man hours and productivity we're losing? And still you have people. I saw somebody who said they're vying for political office the other day, put up on Facebook that the government should invest in some kind of drug, they say. Some of the names too big for me to pronounce. But we should invest in some kind of drug to treat COVID. So after you catch COVID, the government should have this drug to treat COVID, and we should look into that. Now, I am saying to myself, I have never heard that individual say people should take the vaccine that is available and free that will prevent, in the majority of cases, people getting COVID. I hope you understand what I'm saying, Because instead of advocating that we take measures to prevent our people getting COVID in the first place, and I hasten to say that taking the vaccine is not 100% in terms of preventing COVID. But the statistics again are clear that the vast majority of persons who have taken the vaccine either do not contract COVID, or if they do, the symptoms are mild and their ability to transmit it is severely reduced. And so one would have thought that the first line of advocacy would be for people who genuinely care about others and their lives and livelihoods to make the argument, get vaccinated. It's here, it's free, it's FDA approved, get vaccinated. Because if you do so, you give yourselves and your family the best fighting chance. Then I would expect the second argument to come, that for those who contract COVID and need treatment, then we can get this medication. But don't put pressure on the government to talk about you should jump to medication. Medication is treatment, not prevention. It's like saying to somebody, well, I'm not telling you to have safe sex, but the government should get HIV drugs in the event that you get HIV. Well, wouldn't it be better for you to encourage people to protect themselves in the first place? I am not advocating that you do any kind of birth control. But if you get pregnant, the government should have money to support you and your baby. Well, how is that responsible? Prevention. And the old people tell us all the time, an ounce of prevention is worth a pound of cure. So I am calling on the opposition again. Come on board. There is no gain for you in continuing this stance of on the river on the bank, of sitting down on the fence. There's no gain. Come on board. Do like Philip Pear, now Prime Minister of St. Lucia. Do like Tufton and his colleagues and those in the PNP in Jamaica, including the leader Mark Golding, who stood up and made a whole video encouraging Jamaicans to get vaccinated. Do like Kamala in Trinidad. Round up the same way you round up people for some launch, for some election that is a figment of some people's imagination. Round up people the same way, send the buses and pick them up to take them to the sites to get vaccinated. Let's do this together. Because whoever sits in government tomorrow will still have COVID to deal with. It's 8:30, I believe Dr. Rouse is on the line. And we have, as I said, a very special guest. Dr. Rouse, are you there?
I am here, sir. How are you?
I am doing well. I'm not hearing you so loudly. Can you speak up a bit or maybe turn up your volume? Because, the whole nation has been waiting to hear you.
Yes, sir. Can
Good.
you hear me better now?
It's a bit better, yes. Dr. Rouse, welcome to On The Mark and welcome to Nevis. You are not here, but we are hearing you. And we are delighted that you could join us this evening. Thank you for taking some time. We know that you don't have to do this. We know that there is much else that you could be doing with your time, and so the fact that you have decided and offered to do it means a lot to us and to our island and to our country. This show is a pretty large platform. We have our people at home and in the diaspora who listen quite regularly, and I know that many have tuned in tonight to hear from you and to get a perspective as to the vaccine, the COVID-19 pandemic in your own country and in your own state of Georgia, and of course what efforts you have been making and what advice you can give to us as we try to get past this pandemic and to manage the situation so that our people can get back to work and that we can save lives and enhance livelihoods. So I turn things over to you to tell us a bit about the experience there. Tell us your perspectives on the vaccines and certainly what you have seen firsthand in terms of this disease in your state of Georgia and in the wider United States.
So, as you may know, the United States is leading the world in the number of cases and in the number of deaths, unfortunately. We have been inundated with and overwhelmed with COVID infection. There are many of the hospitals are full to capacity and exceeding capacity to deal with these infections. And in fact, in my own hospital, we have been as high as 142% above capacity, meaning that we have patients sometimes that are being cared for in the hallways, in any other area that we could put them securely to try to take care of them. What we have seen, unfortunately, is that this appears to be, or at least this round of COVID infection with the new Delta variant, appears to be affecting the unvaccinated more so than the vaccinated. And I give you a few numbers just to give you some perspective in our own system. In our hospital system, just a week or two ago, about 90% of those individuals that were hospitalized as a consequence of COVID infection were unvaccinated. About 95% of those individuals from January up until September who had died were unvaccinated, 95%. And about a week ago, 100% of those individuals that were in the intensive care unit on the ventilators were individuals that were unvaccinated.
100%?
Yes, sir.
Okay. Those statistics, I think, are very telling.
Absolutely. It's got us seriously concerned. And so we're fighting a battle and a challenge to get those individuals that we come in contact with and other individuals educated and vaccinated. So what we have done is we've had a educate and vaccinate initiative that started actually in the fall of last year, where we have these education seminars with doctors of various expertise, and we have school officials and sometimes young adults, Gen Y, Gen Z generation, to sit on a panel and answer questions about the COVID infection as well as the vaccination. And so we've done probably about 9 or 10 of these events where we educate individuals and then we go out and vaccinate. It's been concerning, some of the, I guess, myths or perceptions of what people have regarding the infection itself as well as the vaccination. And so we understand those things and try our best to educate individuals as to the scientific data that exists regarding vaccines and the infection itself.
Doc, maybe you can assist us because, again, we know you have wide experience and you have seen this, you've been on the battlefield, so to speak. In your engagements in your own state of Georgia, particularly among the African American community there, what are some of the reasons that you might have heard for vaccine hesitancy? And how have you been able to respond to those reasons? Or any of them valid? We hear various things here. I will tell you that some of the things we hear here are mind-boggling. I've heard individuals say that taking the vaccine makes your body magnetic, that it's somebody putting a chip into your body, that it's a design from wealthy people to eradicate people of color. You hear all of these stories. Have you had a similar experience there with this level of hesitancy, and how have you been able to deal with it?
Yeah, so the answer to that question is absolutely. We have had a number of people who believe that there's a microchip that's in the vaccine.
Mm-hmm.
We have had a number of people who believe that the vaccine contains some sort of magnetic information. We have had individuals that believe that the vaccine makes you sterile, makes you gay, it can take your life, it is the mark of the beast, and all sorts of other information. I hesitate to call it myths per se, because that's somebody's belief system. But what we have done is, again, when we have these educate and vaccinate seminars, we address these questions head on and answer those questions. There's no microchip in the vaccination. There's no means of the government or any government tracking you with these vaccines. These vaccines don't make you sterile. They don't make you gay. And so addressing those concerns head on has been the most effective tool that we have had. One of the things that I encourage people to do is avoid some of the social media platforms that give as your source of information. Listen to what your local healthcare officials say regarding the vaccine, regarding the infection. That is the most reliable source of information that you can get. Listen to what the scientists say.
Mm-hmm.
Listen to what the doctors say. But I think that some of this information that's coming across social media platforms is misleading and misguided, and it is absolutely dangerous. In fact, we've had a number of people that have used certain treatments as a consequence of some of the information that they heard, and unfortunately, who have met their untimely demise. So I think that the best tool that we have right now is trying to educate individuals on what the realities are, what the truths are, and dispel those myths, and then follow that up with a campaign for vaccination.
In your experience, Doc, because this is also something that is bandied about here in some quarters, in your experience in your state of Georgia, but also in the wider United States, have you had persons dying from the vaccine?
Well, to date, there has been about 6,000 people, if you will, that have died after getting the vaccine. The problem is you can't make that leap that those individuals died as a consequence of the COVID vaccine itself.
Mm-hmm.
Many of these people, if not most of them, had all sorts of comorbid issues,
mm-hmm.
like diabetes, like heart disease, like high blood pressure, like stroke, that could have also been the cause of their untimely demise. It's just that there is 6,000 people that have died after they've gotten the vaccination itself. But there's no conclusive evidence that say that those individuals died as a consequence of that.
And then
if you go back,
yeah.
Sorry, I was going to say, if you go back and look at the original studies that were done, particularly using Pfizer and Moderna vaccination, there was one person in the placebo group, which means the people who didn't receive the real vaccine, and there was one person in the vaccinated group that died in those studies. So the incidence of death based on those studies, was incredibly low, and it was you were just as likely to die if you had placebo as you were with the vaccine.
You say 6,000. We understand that the link may or may not be causal, but how many people have been vaccinated thus far in the United States?
Over 6 million.
Over?
Yes, over 6 million.
6 million in the state of Georgia or in the wider United States?
In the wider United States.
So in the wider United States, it would have to be more than 6 million. Your population there is about 300 million. I would think that the number of persons vaccinated across the United States would be maybe close to 200 million by now.
Oh, no, you're right. You're absolutely correct. I'm talking about the state of Georgia. My apologies.
Right. So I was trying to get a sense of overall in the United States how many people would have been vaxxed, because I think that's important that people have a perspective in terms, I mean, this is all about numbers and statistics.
So, yes.
Statistics will tell you whether or not something is safe or not. Yeah?
Right. So in the United States, there's about just under 400 million people 400 million doses that have been given.
Okay.
That's in about 186 million or so fully vaccinated.
Good.
So that represents about 56.5% of the population. That's in the whole United States.
Well, I think these numbers are important because when you view that in the context of what you have said, in terms of persons who would have had some difficulty, maybe even deaths, you're not even at 0.1%. So statistically, you're probably more likely to get hit by a car, to get hit by lightning, than you are to die from the vaccine.
Absolutely. And this is the point that we have made repetitively throughout our conversation. That when we see, over 235 million people in the world having gotten COVID infection, and just under 5 million folks have died, those numbers are absolutely staggering here in the States and other countries as well, in terms of how many people have died from the infection in comparison to those who might have died as a consequence of the vaccine.
So share with us a bit, Doc, about the personal experience now in your state and your own efforts. I know you have been doing a lot in terms of education, but what has the response been from the community, particularly to the issue of vaccines? Because in the Caribbean, we have a conundrum. You know that initially the problem was the availability of vaccines. And the larger countries of the world, the wealthier countries of the world, there was a lot of accusation that they were hoarding vaccines, they were not making vaccines available equitably across the world. That is still true in some parts of the world, but in the Caribbean, through diplomatic efforts initially with the government of India, through the COVAX facility, and latterly through diplomatic efforts with the Biden administration in the United States, we have had vaccines made available to us. For example, St. Kitts and Nevis recently received some 11,700 doses of Pfizer, and we expect 2 additional tranches of the same number of doses to take us up to 34,000 or thereabouts doses of the Pfizer vaccine, courtesy of the United States government. This has allowed Caribbean nations to have vaccines on hand available for free to their people. And so we don't have now the issue of availability. We have the vaccine available. The problem really has been that some of our people, unfortunately in St. Kitts and Nevis, a minority, but nevertheless, some of our people have taken a view that they will not take the vaccine. And for all the reasons that you have heard and more, but also because they say, well, I just don't feel like it, I'm not going to take it. Interestingly enough, some of the more stubborn groups here are really persons who are among the more educated individuals that you would think would have the capacity to look at the statistics, look at the numbers, as you have said. One of the arguments that we hear here all the time, Dr. Rouse, is people say, well, I know Tom or I know Mary, and they were vaccinated and they still got COVID. So the vaccine is no guarantee that you won't get COVID. And as I heard somebody respond to that recently and said, well, people who wear a seatbelt can also die in a car accident. A motorcyclist who wears a helmet can also die in a motorcycle accident. But that does not negate the fact that you are safer wearing a seatbelt or wearing a helmet, as the case may be. Have you had a similar situation there? And if so, what has the experience been in terms of uptake of the vaccine as you try to change minds?
So when we have started our initiative, we noticed that in the African American community, because of past experiences, African Americans were not being vaccinated. Some of that had to do with access, some of that had to do with perception, some of that had to do with concerns that historical things that had happened. We also noticed significantly that the Latino community was not being vaccinated. And what we did was really a grassroots group effort to try to figure out why those individuals are not being vaccinated. By having these roundtable personal discussions, and then we actually spent a tremendous amount of time and effort going into the community where individuals live to do two things: answer those questions, and then to actually offer vaccines. So we would attach ourselves to various kinds of community events. For instance, our Thomas Dorsey event is one of those events that we attached ourselves to a gospel musical event, and other kinds of events as well. And so attaching ourselves to those events, coupled with answering those questions for individuals, coupled with making sure that individuals had access to get registered for the vaccine, gave us a tremendous surge in the number of people that signed up. Through my office, we were very concerned at one point about these barriers, and as a consequence of that, I opened up a line in the office to register individuals for vaccines. Sometimes people didn't want to be vaccinated in a large atmosphere, and so we offered that capability through our office. And I remember early on, inside of probably about a week, we had about 400 individuals that were signed up to get vaccinated. So I think that when people are educated, when their questions and concerns are answered, when they're just not dismissed as foolishness or or mythical or out there in space someplace, I think they're a lot more receptive to getting vaccinated. I've had a number of individuals who came up to me after some of the education efforts that we put forth and said to me, "Doc, I would not have gotten that vaccination had I not heard what you all said." And I think those kinds of initiatives have allowed us to be effective at getting people encouraged to get vaccinated in our community.
So let me ask you, Doc. In your community, you are available doctors, individual doctors, like your practice, for example. You can give the vaccine at your offices.
I can, but I'm one of the few practices I think that are in our area doing this. I just took it upon myself because I wanted to protect my family, I wanted to protect myself, I wanted to protect my staff, and I wanted to protect the community. So we took it upon ourselves to make sure that we got engaged in this process to vaccinate anybody who wanted to be vaccinated.
Yes.
But particularly those individuals that we consider to be disenfranchised.
All right. Now, insofar, let us talk for a moment about those with comorbidities or those with underlying conditions. As you know, because you have become one of us here in Nevis, you have spent much time here with us, working with people with heart disease, with cancer, with non-communicable diseases such as hypertension, diabetes. You are aware that insofar as we're concerned, things like obesity, diabetes, hypertension, cancer, those non-communicable conditions remain a major health problem in the Caribbean generally, but also here in St. Kitts and Nevis, and more specifically on the island of Nevis. It is similar, I understand, within the African American community in the United States, that obesity, diabetes, hypertension are also quite prevalent. What do you say to persons here who are suffering from those underlying conditions in the context of COVID? Is it even more critical for them to get vaccinated? What has your experience been, and what could you share with them who are listening and who may have diabetes, who may have cancer, who may have some underlying condition like hypertension, heart disease, or even who happen at this point to be obese? What is their risk level if they're not vaccinated compared to if they are vaccinated? What would be better for them, to be vaxxed or unvaxxed at this point?
So you may recall, Minister, that when we came to Nevis over the last several years, we did analyses and assessments on the incidence of diabetes and hypertension in the various parishes that exist in your country. And what we found at that time was that about 30% of the men that were screened had hypertension, and many of them had no knowledge that they had hypertension. We found that about 40% of the women had diabetes, and then several of them had no knowledge that they were diabetic. We found just under 50% of the women being classified as overweight or obese. What we have found and seen nationwide, locally, and in other countries as well, that when you have these kinds of comorbid conditions, high blood pressure, diabetes, cholesterol issues, strokes, heart disease, and overweight, you have an increased likelihood of ending up in the hospital if you get COVID, and an increased likelihood of dying. And what we've noticed now, that with this new, or with the Delta variant, that seems to be more virulent, more infectious, and more deadly, that we're seeing individuals who don't have those comorbid conditions dying at an alarming rate as well. And I'll tell you, what's so concerning to me is the last 2 weeks that I've spent in the hospital, I've had about 13 people to die who had COVID.
Wow.
And that's an alarming number of individuals. So I'm called in as a consultant to see people that have cardiovascular issues. And those individuals that ended up in the ICU on the ventilator, probably 9 out of 10 of them never make it out of the hospital.
Wow.
So 2 points. If you have any of those underlying conditions, I highly urge you, highly recommend that you get vaccinated, because your likelihood of ending up in the hospital, ending up sick, or ended up dying from this is increased significantly.
So your advice then seems quite clear and unequivocal, that if you have diabetes, hypertension, heart disease, cancer, an underlying condition, then you are in a higher risk group and therefore urged to get vaccinated.
Absolutely. Highly recommend. Unequivocal.
Well, I'm happy to hear that clear recommendation on your part, because I think sometimes our people need to hear it from the professionals. And of course, as we established at the very start of the show, we are speaking to Dr. Rouse, and he has a long-standing practice in the state of Georgia in the United States, and of course has done some work here with us through the Rouse Foundation, dealing with non-communicable diseases, heart disease, looking at our NCDs and the situation here on the island of Nevis. Dr. Rouse, again, I want to thank you for your time. If you don't mind spending a few more moments with us, I would also like to say to you that you haven't been here for some time, and we clearly we understand why, because there hasn't been much travel by anyone. But tonight we had the news that our government has relaxed the entry requirements to the point now where you're tested within 24 hours of arrival and released if you're negative. So I say that as an aside, just so that when you and your family decide to come back, it is far easier for you to come. And of course you have a constant and never-ending invitation to be here with us, because you have shown us so much love and we show it back in return. So we want to thank you for all that you've done in the past, and thank you for taking the time with us this evening as well. Before you go, however, I wanted to just drill down a bit in terms of the vaccines. I know in the United States you have not used the AstraZeneca. You have used Pfizer, I think Moderna, and Johnson & Johnson, because those are homegrown vaccines, so to speak. Here in the region, we've used AstraZeneca, and we're now using Pfizer as well. I know that vaccines work differently, so I don't want to get us too bogged down in the science of it. But tell me generally, what, as you understand it in your medical expertise, does the vaccine do for us? Once we get vaccinated against COVID, what does that do for us in terms of our body, our chemistry, and how does it help us to fight this disease?
So what the vaccine does is it triggers your body's response to something called the spike protein. No matter what vaccine that you're using, that's the mechanism by which it operates. So it triggers your body to produce it. First of all, these spike proteins that are produced once this vaccine is injected is recognized as something foreign.
Mm-hmm.
And then what the vaccine does is when it sees this foreign material, it produces what they call T cells and B cells. These are the cells that help to fight or increase your immunity against something that shouldn't be there, some virus or whatever the case may be. Once that happens, those B cells and T cells go back to their respective homes and wait for something else to come in your system, i.e. infection from COVID, and then it attacks the COVID and reduces the likelihood of you becoming infected and reduces the likelihood of you becoming sick if you do become infected.
So basically, if I can put it in sort of layman's language, tell you how I understand it, you tell me if I'm correct, that what the vaccine does is it actually primes your body, it gets you prepared, so that if you do encounter COVID, your body is in a position to fight. Would that be accurate?
That's absolutely correct.
So basically, the vaccine allows us a mechanism. It's like a training for a military person. You know, if you go into battle, this is how you respond. Training for law enforcement, this is how you deal with crowd control. It really trains the body to respond to any attacks from the COVID virus. And that, frankly, is, as I have understood it, how all vaccines work. They seek to prepare the body for any attack from a particular disease. So I'm happy that you've confirmed that my understanding is accurate, because, truth be told, Doc, we've had a number of diseases eradicated in our region from vaccines. You take polio, for example. I have had the privilege of visiting Senegal in Africa, and we went to an island called Gorée Island, which was the last sort of point of departure for many of our ancestors who were enslaved. And the chap who was our tour guide was badly crippled. Didn't affect him in terms of his mind and all of that. He was, in fact, one of the best tour guides I've ever had, very knowledgeable, but badly crippled. And I asked him if he was in an accident, and he said, no, polio. This is something that we in the Caribbean, and certainly in St. Kitts and Nevis, have not seen in my lifetime. And I'm now an older man in my 50s. So it demonstrates that vaccines have eradicated and can be used to eradicate many diseases that were afflicting us as humanity. I can, for example, tell you that here, to go to school here, to go to public school, you're required to vaccinate. And as a boy, when I was in school, the nurses came to the school and we all had to line up and take our shot in our arm for mumps, rubella, measles, tetanus. We get all of these things. And somehow there wasn't this uproar. We didn't have people demanding to know what was in it. We didn't have the suggestion that it would make us gay or sterile, that it would be the government trying to track us. So there is a long tradition of vaccination, and I'm sure your experience has been the same, Doc, in the United States, a long tradition of vaccination. So why do you think there's a difference now?
Well, I think a couple of reasons. One, unfortunately, COVID and the COVID vaccines have been politicized. Unfortunately, many people get their information from the internet and other sources that may not be as reliable. And then thirdly, I think that what has transpired is the rapidity for which the vaccine was done. Usually vaccines take a longer period of time, of course, to develop. And I tell people all the time, I'll take that third point first. When I was involved in research, whether or not I was in training or actually in practice, the limiting factor to getting research performed or concluded was funding, right?
Mm-hmm.
So in this current situation, the federal government partnered with these large pharmaceutical industries and said, make a vaccine. And so that's how we were able to make these vaccines so quickly. This technology for these vaccines is nothing new, right? This is technology that's been around for a long period of time and been used in other vehicles like cancer, like prostate cancer, for instance. But I think the rapidity or how rapidly these vaccines were developed had individuals concerned. And then the misinformation and misguided information that people receive through these various sources is incredibly concerning. And that's why I advocate listen to the medical professionals, the scientists, your personal physicians, but don't rely on the information that you get from internet sources to be the be-all, end-all information.
Dr. Rouse, the million-dollar question perhaps that I will ask is the COVID-19 vaccine safe, in your opinion?
Absolutely. That's data coming from the FDA, which is a closely a governmental organization, but closely made up of scientists that closely regulate and monitor the safety of these vaccines. And organizations like the CDC, which is the Center for Disease Control, that monitors the safety, the accuracy, and the effectiveness of these vaccines. And then you look at the worldwide data that exists. How many people have received vaccines? How many people have had adverse issues as a consequence of the vaccine? When I say adverse issues, I'm talking about dying and other kinds of things that people are concerned about. The incidence of having a problem with the vaccine is low. That's not just, those are not just my words. That is the data that exists. And the incidence and deaths associated and illness associated with getting COVID-19 is significantly higher than your risk of having an adverse outcome as a consequence of getting the vaccine.
Okay.
And I make mention this. If you don't die from COVID-19, there's a condition that I'm seeing a lot of patients in my office called post-COVID syndrome. I had an attorney that came in to see me who had COVID 4 to 5 months before she came to see me. She came to see me as a consequence of shortness of breath and chest discomfort. But during our interview, she said, "Doc, I can't think straight. I'm a litigator. My job is to argue my perspective, and I can't think straight."
She can't think. I'm sorry. She can't think straight.
That's right.
Yeah.
So she had to reduce her amount of work that she was doing down by 98% because she could not go to court to argue her perspective and do the things that she normally would do. And I see this over and over and over again. I've seen several, hundreds of people that have had this kind of issue, this sort of post-COVID syndrome that is absolutely debilitating and can last for a long period of time. And some of those symptoms with this new variant don't seem to dissipate or go away as quickly as they did with the older variant.
So is that what the literature I'm seeing is referring to as long COVID?
Yes, sir. Long hauler syndrome. That's correct.
Okay. All right. So your clear advice is that the vaccines are safe. Yes? Yes. Second question. In terms of our fight, and this is a global fight against COVID-19, do you think the vaccines are necessary?
It is absolutely necessary for several different reasons. One, what we're trying to achieve is this concept of something called herd immunity, and that number of people that need to be vaccinated or haven't had the infection is about 70%. So we have to have the vaccine to accomplish that, because allowing people to get COVID naturally or not allowing people to be infected with COVID, you run the risk of having this severe illness, run the risk of dying, strokes, heart attacks, and this so-called long hauler syndrome. So that's not practical way of achieving this concept of herd immunity. So I think that the vaccine worldwide, to travel, to engage in business as we normally would, on a local, statewide, countrywide level, is absolutely imperative and important that we become vaccinated. Absolutely important.
Okay. So you've given us this evening your professional opinion that the vaccines are safe and that the vaccines are necessary. Now, let me move to a third question, because there are many here who say, I can drink bush tea, I can boost my immune system by taking immune system boosters, eat healthy, exercise. Is that a substitute, in your opinion, for taking the vaccine?
No, we have a number of those initiatives that we are combating here in the States as well. And while I encourage people to do all kinds of things to boost your immune system, eat healthy, get plenty of rest, take certain supplements, those things are not a substitute for the vaccine themselves. Because if you get COVID, you may not be aware that you have certain underlying comorbid conditions. And you may end up in the hospital, and worst case scenario, you may even die as a consequence of that. I can't tell you the number of people that I've been involved with in the last several months, 2 months or so, who have been quote-unquote healthy individuals who have presented to the hospital with COVID infection. And many of them, we've discerned they had other kinds of issues going on, and unfortunately, several of them have died. And so I don't advocate using those kinds of things to boost your immune system as a substitute for the vaccination. I think the vaccination is the best tool that we have at this point in combating this pandemic that we are facing.
Dr. Charlie Rouse from the great state of Georgia in the United States of America. It has been an excellent conversation, Doc. I do not know if there is anything further that you have that we have not covered, but certainly I think for me the important questions were, of course, to dispel the myths associated with the vaccine, to indicate that in your opinion the vaccines are safe, they're necessary, and that while boosting our immune system is always important, that we eat right and rest and exercise, it is not a substitute for taking the vaccine. I believe that those points have been very carefully covered, and you have been unequivocal in your position, and so we thank you for that. Is there anything further that you have that you would like to share with us?
Yeah, here's the thing that concerns me. I can't tell you the number of individuals that I have seen in the hospital. Once they get to the hospital, the first question they ask me is, with the COVID infection that is, the first question they ask me, Doc, can I get my vaccine now?
Wow.
The last individual that I had a conversation with, and this is probably just a few days ago, he was 50-ish year old and had no significant past medical issues, a history of comorbid conditions. He was hospitalized, and when I came in to see him, he was requiring oxygen in order to keep his oxygen up. The second day I came to see him, his oxygen requirements increased more. And he looked at me with tears in his eyes and said to me, Doc, am I going to make it out of the hospital? And I said, Mr. X, we're going to do our best to get you COVID. I said to him, but tell me, what advice would you give your friends, your social circle, your family, and other people that you come in contact when and if you do make it out of the hospital? And he said, I quote, I'm going to shout at the top of my lungs that you need to be vaccinated. You do not want COVID, because I had no earthly idea that I'd be this sick. Now, I'm happy to report that he was able to get out of the hospital.
Praise God.
And go home. So I encourage people to get the vaccine. I have said this over and over again. I personally am vaccinated. I was in line to get vaccine as quickly as it became available for me. I still encourage people to wear masks. I think that's important, especially in crowded areas. And I still encourage folks to sanitize. Keep your hands clean. Keep some sanitizer in your pocket so that anytime you open a door, you in an atmosphere. You're just constantly sanitizing. I think those things have been truly effective at helping us reduce the spread and becoming infected with COVID as well. But none of those things are superior to getting vaccinated.
Doc, let me, before you go, I recognize that you have really been very generous with your time, but there is an argument that I've heard in some circles here, where people have said, well, I prefer to take my chances because if I get COVID, I will be able to develop antibodies naturally. And so rather than using the vaccine to prime my body to fight COVID, I will fight the COVID and develop the antibodies naturally. How risky, in your opinion, is that approach?
I think that's very risky. And I say that based on the actual data that I know that exists in your country, the analysis that we did earlier over the last several years, with the high incidence of high blood pressure, the high incidence of diabetes, the high incidence of cholesterol issues, the high incidence of even being overweight or obese, that's incredibly risky because you never know if you have one of those comorbid conditions. And if you do have one of those comorbid conditions, you're more likely to end up sick as a consequence of getting COVID in the hospital or even dying as a consequence of that. So I think that's a risky way of protecting yourself. And my mother used to say all the time, my grandmother as well, that an ounce of prevention is worth a pound of cure.
Mm-hmm.
So if you can engage in some behavior, if you can engage in some practice that will protect you, and it's not only about you, it's about your loved ones as well. It's about your friends, right? So, and your circle, your cohort. If you can develop a technique or a procedure, a process that will help to reduce the likelihood of you getting infected or infecting someone else, then I think that it's our responsibility to do so. And that tool that we have in our armamentarium right now happens to be the vaccine.
Okay. Dr. Rouse, let me thank you on behalf of all of us here at Vaughan Radio, but also on behalf of all the people of Nevis and St. Kitts, those at home and those abroad, because I know that you have been widely listened to this evening, for taking time out of your busy practice. It's nighttime there as well, so clearly you could have been spending time with your family, but you have decided to be here with us. And I would really want to thank you and to extend thanks to Ursula Phillip as well, who made the arrangements for you to be on with us this evening. Thank you very much. We owe you a debt of gratitude, and we continue to appreciate the immense contribution that you have voluntarily made to the health and well-being of our island and our people. I believe that tonight you've spoken quite clearly, quite unequivocally to your own experiences and flowing from your own expertise as a seasoned medical practitioner, that the vaccine really is our best choice. And this is a message that we have been trying to convey to our people time and time again. It is perhaps difficult for me because I'm not trained as a doctor, but here we have heard it from you, and you have that expertise. And so let me go on record to thank you from the bottom of my heart on behalf of us all for your contribution and for your interest and for your generosity of time and spirit that has helped us so much this evening to get clarity on a number of these issues.
Absolutely, and thank you for having me. I really appreciate it.
Okay, thank you. Ladies and gentlemen, that was Dr. Charlie Rouse calling in from the state of Georgia in the United States of America, a man who is no stranger to the island of Nevis, who has come here in the past to offer free his services through his Rouse Foundation. I would want to thank him, thank my dear friend Ursula Phillip for organizing this. And I think that the chat was an interesting one. We had nearly an hour together talking about COVID, and I think my takeaways are: one, the vaccines are safe; two, the vaccines are necessary; and three, that this notion that you can boost your immune system and do it naturally to fight COVID, that is not the best way. There's no substitute for the vaccine. And I would say 4, that deciding that you prefer to get COVID and develop antibodies that way is very dangerous, not only to yourself, but certainly to your family members, neighbors, co-workers, friends. And so I think we had a very clear exposition this evening as to what is happening and the perspective coming from the United States in terms of some of the similar challenges of hesitancy and the like. It is my hope that our effort tonight would have been educational and that those listening would have come away with a better understanding of what it is we're seeking to do when we encourage our people to get vaccinated. Ladies and gentlemen, this is On the Mark. I'm your host, Mark Brantley, and as I said, we just heard from Dr. Charlie Rouse. It is now 22 minutes or so past the hour of 9 o'clock. I will open the lines now in the event that there are individuals out there who have something that they would want to say and to join the show even at this late hour. We have just about 35 minutes or so left, and so we'll take as many calls as we can. Please, when you call in, be as brief as you can, be as forceful as you can. We'll get to the point so that we can accommodate as many as we can. Let's go to the phones and say good evening. You're on the mark.
Sheriff, good night.
Good evening to you, my dear.
And how are you tonight?
I am always better when I hear your voice. How are you?
Well, I give God a big thanks.
Yes.
Jeremiah 33, verse 2 and 3. Thus said the Lord, the maker thereof the Lord, that formed it to establish it. The Lord is his name. Call unto me, and I will answer thee, and show thee great and mighty things which thou knowest not. Sympathy is going out to all who lose their loved ones. Culture, good night. Thank doctor to call and explain to us what is going on with COVID. And again I said good night.
Thank you very much. And at this point, let me not let this show end or go on for any longer without saying happy birthday, happy 50th birthday to my dear friend Sandrine Nolan right in Cool Hill. Sandrine, I want to wish you a happy birthday. I know that you turn 50 tomorrow. I can't say you don't look a day over 25. I see you all the time. You look absolutely lovely. I want to wish you a very, very happy birthday. God's continued blessings be upon you and your family from all of us here at Von Radio. Happy birthday to you and happy 50th. May you have at least another 50 and then some more on top of that. Happy birthday when it comes. Ladies and gentlemen, this is On the Mark. We're taking your calls. Let's go back to the phones. Good evening, you're On the Mark.
Hey. Good night, Mark.
Yes, good evening to you.
Good night. Look here, right? I meet a lady, I meet a farmer nurse. Nurse one. Everybody knows she. A couple of years old on me, right? And she look young. And she tell me she take the vaccine. And she look young and it feel nice. So he tell me he encouraged me to take it. I'm going to take it.
Well, I'm happy that you encouraged to take it, right? So go tomorrow, please, and get the vaccine, okay?
Huh?
Go tomorrow to the clinic and get the vaccine.
Oh, yeah, tomorrow.
Okay.
So, at 2, you go get it to 2 of them one time?
No. You take one, then they will give you a time to come back for the next one. Okay?
That's why I look good, so I'm going to try.
Okay. Thank you, brother. All the best. All right. We are 25 minutes past the hour of 9 o'clock. We're taking your calls. 869-469-1616 and 869-469-1700. Let's take this call. Good evening. You're on the mark.
Good night. How are you?
I'm well, thank you.
Explain a little bit more to me about that thing you said. What are you going to? How we go now? You're coming in for a day, and if you're negative, you explain a little bit more to me now. What you say was passed today. They said it today.
If you are coming in as a passenger arriving into St. Kitts and Nevis and you are fully vaccinated, then you have to do a PCR test 72 hours before you arrive, and that has to be negative. So you arrive into St. Kitts and Nevis with your vaccination card to prove you're fully vaccinated and your negative PCR test, and once you arrive, you'll be tested here within 24 hours, and once that negative result comes back from our local labs, you will be released. So the days of sitting for 14 days or 9 days or 4 days, those days are now over. Now, if you are unvaccinated, you still have to do 14 days. So this is only a benefit for those who are vaccinated. So I hope you're clear on that. If you need further clarification, then please call back in and I will do my best to clarify further. Ladies and gentlemen, some good news. The island of Nevis has been voted by Condé Nast Traveler as the second most sought after, most desirable, most desired destination in the Caribbean and the Atlantic. We were beaten to the first spot by St. Bart's, our neighbor, by just 0.02 points. And we beat out Anguilla, which was right behind us. So the top three are St. Bart's number 1, Nevis number 2, Anguilla number 3, and then we move to the big island of Jamaica number 4. I would want to commend J.D. Nyard, our CEO at the Nevis Tourism Authority, and her entire team there for the excellent work that they've done despite the challenges of COVID. I would also want to thank all of our stakeholders, our hoteliers, our restaurateurs, our workers, our taxi drivers, our tour operators, and all who make Nevis this very special place that it is. Number 2 is an excellent position for us to be in, bearing in mind the challenges that we've experienced from COVID, from having our airports closed, our borders closed, to where we are now. And it is my hope that as we get an indication of how the outer world sees us, that we will continue to strive to regain the momentum and to get our tourism industry back on the secure footing that it hitherto had. And so I'm very, very proud and pleased that we've had this accolade, and I would want to say thank you. Let me also invite all who are watching and listening that you go to our brand new tourism website at www.nevisisland.com, NEVISISLAND.com, and see what again we're doing. You see, I have said repeatedly that as a government, we could have said COVID is here, and so we put our hands up and we surrender. We wave the white flag and we say there's nothing we can do. Like Chicken Little, the sky is falling, woe is me, woe is me. Yes, times have been hard, but we have not relented. We have continued to do our very best to respond. And these are examples of how those efforts are bearing fruit. So today we launched a brand new website for tourism, www.nevisisland.com. And yesterday we got the news that Nevis was ranked number 2 in the entire Caribbean and the Atlantic, the number 2 island, the most sought after island, just behind St. Bart's. And as I said today in my press conference, and as we would say here colloquially, Nevis lost out by an And everybody in Nevis know when you lose by an it means it's not much. So I'm very, very grateful for that and thank those who have made it possible. Again, we're hoping that you could call in. We have a half an hour to go. 869-469-1616 and 869-469-1700. Those are the numbers to call. Now, let me take a moment. Okay, here go the phones. So let's go back to the phones. Good evening, you're on the mark.
Good evening, Mr. Brantley. This is Karen Wilkinson calling. I'm just calling to get a little clarity on what you said in regards to persons coming in to the Federation who are vaccinated. I'm planning on coming to Nevis, and I know before that you had to submit your test maybe online or something. So what you're actually saying is that you can walk in with the test being negative?
No, I'm not saying that at all. I'm saying
how do we go about doing that?
You still submit your test in the usual course, but now you submit your test, and when you arrive, you no longer now have to go and sit someplace for 4 days before you can move out of quarantine. So the process is the same for entry. What we have changed now is the length of time that you have to spend locked up once you get here. Hello?
Oh, okay. So you still go through the normal process of submitting the information the same way online as they did before.
Right. So you upload all your information just as before, so that we get advance notice that Karen Wilkerson is coming. She's negative PCR. She's fully vaxxed, and then when you arrive, within 24 hours of your arrival, you would get a test, and once you're negative, you're free to go.
Okay. Thank you so much for clarifying that for me.
Okay.
And you have a great evening.
Great. You too. Thank you. And just again, for persons who may have some doubt, last week, for example, when I came back from New York, I uploaded my information. I came into the Federation. I had to sit at home in quarantine for 4 days before I could test, and then wait on the test results before I could come back out to work. So we are saying that 4 days is no more. Let's go back to the phones. Good evening, you're on the mark.
Hello, good evening. How are you?
I'm well, thank you. Good evening to you.
All right. I just want to send my sympathy to my uncle and the family in Bad Village. Just want to tell him to stay strong, and also for the family to stay strong. Sorry that we can't be there at the moment, but if we're not there physically, we're there in spirit.
You want to tell us who your uncle is? You just say uncle and family. We don't know who you're talking about.
His name is Euclid Jones, better known as Flakesy of Bad Village.
Okay.
And the Amri family.
Sure. Okay.
As well as the Prentice and the Smittens.
All right. Thank you very much for that. Okay. And please accept my condolences as well. I did speak to him on the phone, and certainly have extended that privately. I do so now publicly as well, and join you in extending condolences. It's a difficult time when people can't travel, as we are accustomed. But I'm sure that he'll be happy to know that the family abroad is supporting him and the family here during this difficult time.
Yes.
All right.
Thank you very much.
And thank you for your call. Thank you. Ladies and gentlemen, we have 25 minutes left. We are taking your calls. 869-469-1616 and 1700. Now, while we wait for the phones to ring, let me do a little report to you on this, what I call the Ann Bass saga. We are aware that a very wealthy American woman adopted Nevis, came to Nevis, bought a lot of property here, and has been a significant investor and employer on the island of Nevis, and for which we are grateful, Miss Ann Bass. At some point way back in 2015, 2016, some Chinese investors came and wanted to do a development called the Candy Resort. They bought land for a few $1 million, 4.4 acres of land, and they came up with a plan to do this Candy Resort, which would constitute, I believe they said, was 54 condominium units spread across 18 buildings. They did an environmental impact assessment. They were approved to proceed by our planning department. Ms. Bass took offense to these individuals doing what they proposed to do, and decided that she would take the government to court, the planning department and others, to stop this development. As a government, we are always interested in attracting investment. As a government, we have always been prudent about the environment, and so we felt a little put upon that this action would be taken against us to effectively stop an investment from proceeding. Those of us who live in Nevis, those who visit, would see a number of buildings in the St. James area. As you pass ex-Petrol headed into St. James going north, you will see these buildings unfinished, and that was as a result of this case. The buildings now are an eyesore, rusted, have been standing there in the elements for the past 5 years. Ms. Bass made some unfortunate allegations about me in particular, and I well remember that the NRP party here jumped on and piled on and thought, as usual, that they had a winner. Well, we went to the court, I gave evidence, and the court ruled against Ms. Bass and said that they could find no fault in the circumstances with what had happened. Miss Bass, in any event, had brought her case late in the day, and that they could not grant any relief to her. I should point out that the concerns that had been raised about the EIA, the Environmental Impact Assessment, were subsequently addressed by the developers, who did an additional EIA, specifically dealing with the concerns that Ms. Bass had raised. Notwithstanding, she continued with the litigation. And so, unfortunately, regrettably, Ms. Bass passed away. And we thought that with all that had happened, that this matter would have been at an end. However, her estate decided that they would appeal and go to the Court of Appeal on the matter. I'm very happy to report that the Court of Appeal has also rejected this case and has dismissed the appeal and upheld the decision of the trial judge. It therefore means at this point that the case is at an end, unless, of course, her estate decides to try and appeal it all the way to the Privy Council in England. I would want the public to be very clear that as far as I and my government are concerned, we are seeking development for Nevis. And I was particularly disturbed that for the many who keep challenging and attacking us and saying we have been unable to bring investment, that when investment does come, those people are still aligned with individuals who would like us not to develop and would like that investment to be turned away. We can't have it both ways. The people of St. James, had that resort been completed, would have had jobs. The contractors would have made money. TDC Hosfords, all of those who sell building materials would have benefited. And we would now have people out there managing the place, working in the place. Even if it's a simple job as a gardener, we would have had activity. Instead, we have rusting, rotten buildings standing there benefiting nobody. Why? Because one individual decided that that is not the type of development that Nevis should have. Anybody who supports that, in my view, cannot be a lover of Nevis and cannot be a supporter of Nevisians. And so I am delighted that the court has now ruled not once but twice in favor of the government. And I would want to go on record to thank Miss Jean Dyer, one of the best litigators that I have had the privilege of working with, whom I knew as a young litigator, and who, if I can take a little credit, I would have done once or twice, offered a word of advice and training to her. And she came and worked here and had spectacular results, not for me, but for the people of Nevis. And so I thank Miss Dyer. She now has her own practice in Anguilla, for her excellent, excellent handling of these matters, both in the High Court and in the Court of Appeal. And I am hopeful that these developers who left in disgust after all these years may be interested in coming back and finishing that particular project for the benefit of our island. So I just wanted to report to the public on that. And let's go back to the phones now at 20 minutes to. Caller, if you can forgive me, because I was just trying to finish what I was reporting, but call back now and let's go to the phones. Good evening, you're on the mark.
Good evening, Mr. Brantley. How are you tonight?
I am well, thank you. Good evening to you.
Giving God thanks. Just keep the faith, eh?
Thank you.
Don't anybody distract you. Now, somebody called about Flaky Jones. Somebody died for them?
Yes.
Oh. Flaky, but you know, Flaky and they, you know, is my relatives.
Well,
Flaky for Tamin?
Yes, Flaky from Overbad.
Yes, is there used to spend my thing. His mother was my father's cousin. About the pain and receipt and there.
Well, I extend condolences to you as well.
So
the family is in mourning.
them?
I think it was his missus has passed.
His wife?
His wife, yes.
Oh, well, Flaky, if you're listening, this is Sylvine, your cousin from St. Kitts. My condolences to your family. I met the wife at the time he brought her to see me.
Mm-hmm.
Now I want to get something clear, because a relative of mine is supposed to come weekend. Now, will special provision be made for them to get the test results back in time? Because right now we are having problems with people getting back their results when they go in quarantine. Some people say days, weeks, they're there. So I am saying if we are offering people the option now of spending one day and then have the test.
No, that's not what we're saying. We're saying that you get tested within the day.
Yeah, but about how soon? Because if you run a test and you can take the next week to get back the results, you have to be paying the hotel if you're in a hotel.
Well, we understand all that, but if you have to sit down in the hotel for 4 days and then get tested and you last a week to get the result, that's 11 days.
Now, I was asking, will special provision be made for...
I can't tell you that special provisions will be made.
I hope the medical thing think about it.
Right.
Once you come in, you know.
Okay, well, if you listen, and let me explain. Once you get in, currently, you have to sit down wherever you are for 4 days.
Yeah, I know that.
Then you test.
Uh-huh.
What we're saying is once you get in now, within the first 24 hours of you being here, you will be tested. And hopefully the labs can turn your results around so that you're out and about. The reality is that the labs have had some issues in the recent weeks that has led to a backlog. But we are optimistic that those issues are now behind us and that we'll be able to move forward. In addition to which, we are getting testing capacity now in Nevis, which we hope to launch this month, so that Nevis tests will no longer have to come over to St. Kitts. So that will also ease the pressure on the labs. So it is our expectation that we will be able to turn around the test results quickly.
The message, you see, the person coming in weekend. Now, if sister, that is flaky sister, if sister listening, sister, this is your family, Sylvine, sending condolences to you and all the family of Flaky's wife. May God grant us peace, and all the people who are grieving, all of those who died from COVID. And I keep hearing you pleading and begging, you know, why wait until somebody for you reach the point where you hear the dead? Because I wonder, people just want to do statistics. That's not a nice way to do statistics, you know. Well, it was 10, now it's 12, now it's... Some people counting every day, you know, like how they used to count murders. Some people counting deaths, like how they used to say, oh, well, one of them got shot last night. Nobody benefits. So please, if you are able, go and take the vaccine. If you can't, go and see your doctor. All right, then.
All right, thank you very much.
For always call me 465-3645. All right, then.
All right, thank you. It is 1:45. Let's go back to the phones. We have anybody holding? Good evening, you're on the mark. Hello? Okay, we've lost that caller. Callers, we beg for your patience. 869-469-1616 and 869-469-1700. Those are the numbers to call. I'm getting a lot of messages and calls that this 24-hour thing is confusing. I've tried so hard to explain, I don't know what else to say. Currently, if you come in fully vaccinated, you have to sit somewhere at your home in a quarantine facility for 4 days. And then at the end of those 4 days, you're tested. And if you're negative, whenever you get back that negative result, you are free to go. Now we're saying once you arrive, within 24 hours you will be tested. And once you get your result back, you're free to go. Negative result, that is. I don't know how best I could explain it. So let me try a practical matter. If you arrive in country on American Airlines 3 o'clock Sunday afternoon, within 24 hours, that is before 3 o'clock Monday afternoon, you will be tested. And as soon as you get your negative result, you're free to go. I hope that is clear, because the number of people who are telling me they're confused is, for me, confusing. So, if you're still confused, call and let me try again. It's 1:45. Let's go back to the phones. No? We had somebody who had been holding, so please call back. 469-1616, 469-1700. Let's do that. Good evening, you're on the mark.
Good night, Johnny. Good night.
Yes, good night to you.
Yeah, Mark. I always hear consciously coming out and with this COVID as a leader, and I support you doing that, and I believe that's the right thing you're doing to the people of Nevis. Now, Mark, I was listening to the briefing this afternoon, the LOC briefing, and someone asked a question about like if the government gonna make the vaccine mandatory, like how some other country like Antigua and other country do it. And I was surprised that when Ms. Phipps answered the question, she said no. Government ain't gonna make we going to make them this country because that the people in here go out and take the vaccine within 70 percent with the first dose, and with the second dose I think 69%. So government ain't gonna make it mandatory. Mark, so this is so that right. I believe that the people of this federation understand. We are educated people, we are sensible people, and we are the naysayers and the people who want to mislead and distract people by whether Facebook, YouTube, with the fake news. I believe that we're going to get over the hurdle. Because yesterday when I see the tourist boat come, and I see how they organize themselves and organize the people them from them down Port Zante, that you cannot interact with tourists, I say that it is a stepping stone going forward. You know what I mean, Mark? We got to do something. We cannot keep the country closed down because COVID will be here for time. And maybe it will be here forever. We got to live with it. Some gonna die, some gonna live. But the only way out, as the export them say, take the vaccine, and whether you got underlying condition or whatsoever, the vaccine is there to protect you from either dead or you get ill bad with the COVID. Mark, you have a wonderful day. God bless you, the Federation of St. Kitts and Nevis, and God bless you for your wonderful job you're doing, because you always come out passionate and telling the people go out and take the vaccine. All right.
All right, my brother. Thank you very much. Let me just make an announcement here. I think that's important that I advise, of course, that we are in Pinktober, we're calling it. We are uniting and rallying around our men and women who are suffering from breast cancer. And as part of that, we have lit up our Nevis Nice sign, a welcome addition to the island. And that sign has been lit in pink for the month. We also have, as part of the event, a virtual podcast that's going to happen on 7th October. That's tomorrow. And it's going to be live on NTV, YouTube, and Nevis Health Promotion Unit Facebook page at 7 p.m. It will feature Mrs. Kamara Lee Prentice, Honorable Hazel Brandy Williams, and Dr. Marissa Grant Tate. Dr. Tate is an oncologist. Honorable Hazel Brandy Williams, as you know, is the junior minister who manages the Ministry of Health day to day. She will host, and Mrs. Kamara Lee Prentice is described on the flyer as a warrior, and they will be on tomorrow. So we're encouraging, of course, people to tune in at 7 p.m. to be a part of that particular event. Let me go back to the phones. It is 10 minutes to the hour. Good evening. You're on the mark.
Good evening, Mr. Premier. How are you doing?
Good evening to you. I am fine.
Fantastic. It seems as though, as you just mentioned a while ago, quite a number of persons are still not very clear on the new regulations. Someone just called me, and I thought I should call in as well to give a little bit more clarification, because I think you probably didn't mention this, and I think persons are wondering, because as a lady would have called in from the U.S. and asked whether or not she still have to do the online thing and that kind of stuff. I think you told her that everything else remains the same except the period of time. But some persons now are wondering whether or not they still have to go into a facility, they have to be at a hotel. I think everything remains the same except for the period of time. If you're coming in, you still have, because remember, you're not cleared as yet. You test within that 24-hour period, but you still have to either go to a hotel or a quarantine facility, or your home, if it is certified, if it is persons come and they inspect and your home is good enough for you to quarantine at. So in effect, you still have to do a quarantine period. Everything remains the same except that the time is now less. So you still have to either go to a quarantine facility or a certified hotel, or if your home has been inspected and passed, that you can quarantine there. I think some persons were a little bit confused where that is concerned, but that remains in effect, because in effect you're not clear until you get the negative test.
Okay, well, I'm grateful to you for that. I had assumed that when I said everything remains the same, except, just as you have said it,
yes,
that people would understand that.
Mm-hmm.
So, again, out of abundance of caution and for clarity, if you're coming in from outside, you still have to go online, upload your documents, your negative PCR test, and your COVID status, your vaccination status, I'm sorry. When you arrive, you still have to go home if your home is approved. Or you go to a government quarantine site or hotel, Four Seasons, Orly, whatever, and Potworks, wherever. The difference now is that you're tested within 24 hours and released if you get back a negative test.
Right.
All right?
And I think the regulations also said, Mark, that some of the hotels can actually arrange for the testing to be done there at the hotel as well.
Well, I don't know if that's said in the regulations, but I do know that that is being done as a practical matter, because the hotels can arrange, of course, to have testing done at the hotels.
Right.
And, you know, guest houses, whoever has been approved can have testing done there. So the issue really here, in my view, is, as I said, having gone through it recently, rather than coming back and sitting down in my house for 3-4 days,
right,
and then testing after that, and then waiting for the results.
Right.
Now, once you come in, you test within that 24 hours, and when you get your result back, which might be the next day, which might be the same 24 hours,
right,
you are then released.
Precisely.
So that really is the fundamental change. So thank you very much, Eric. Absolutely. I hope with you and me, we have put the matter beyond doubt.
Let's hope.
Let's see if we have any more calls.
Thank you. Have a good night.
Thank you, brother. All the very best.
All right. Bye-bye.
All right. So that is Eric Evelyn trying again to explain what we thought was well explained, but we have a few more minutes again. So if there are more calls and people want further clarification, we'll be delighted to do so. Again, good evening, ladies and gentlemen. This is On the Mark, and I'm your host, Mark Brantley. And we're taking your calls. We still have about 7 minutes left, so we can take a few calls at 869-469-1616 and 869-469-1700. As the show comes to a close, let me take some time to celebrate my friend and colleague, the Honorable Alexis Jeffers. The Honorable Alexis Jeffers is celebrating 10 years as a parliamentarian. He would have won his first election in 2011, and so this year marks 10 years that he is a member of Parliament in the Nevis Island administration. Of course, he became a member of the federal parliament in 2020 and continues to serve, in my respectful view, with distinction. I have a very special place in my heart for Alexis, not only because we went to school together, we would have gone to sixth form together. He was at my wedding many, many moons ago in Grenada, and he and I have really entered the political arena together. And as we sometimes joke with each other and say, we entered in opposition, which is always a difficult place. The CCM, when we joined, was in opposition, having lost the election in 2006. And we joined in opposition, we worked hard, and we were able, with the Honorable Vaccination at the helm, to bring CCM back into office by 2013. Cheated in 2011, fought that in court, went back in 2013, and we've been in government ever since. I have seen the mettle of the Honorable Alexis Jeffers. I have seen his love for St. James. I've seen his love for Nevis. I've seen his passion. I have seen him in the federal cabinet raising issues that are relevant to his constituents and to our island. I have seen him in my cabinet and in the cabinet before of Vaccination. And I know that in him, the people of St. James, the people now of St. James and St. Thomas's federally, and the people of Nevis have a warrior. We don't have to ask about his accomplishments. Somebody had called sometime and said, "Oh, what has been done in St. James?" And I said, well, look at the water taxi pier. He was in charge of that project and he delivered. Look at what that has done to transform transportation between the two islands. The water taxi operators are 100% Nivision in terms of owned and controlled, and Alexis Jeffers was the man that was charged with that particular effort. That's in the parish of St. James. Look at the Newcastle police station. When many others said it could not be done, he insisted that it would be done. And it is now by far the best police station and fire station in the country, by far. Again, he was the one who was charged with that and getting that done and accomplished for the people. Look at the roads in Shaw's Road, the road that is now being done in Butlers. Look at the housing development in Maddens. It is, in my view, one of the most beautiful housing developments anywhere on the island of Nevis, where already many homes have been completed, and I'm advised as of today another 31 homes are planned. I think it's Cedar View. I hope I have it correct. That's just in St. James. But you look at across the island, you look at the transformation in agriculture. The Cadesville Leisure Farm, the 35 acres now of fruits that have been planted in Indian Castle. You look at the Lanston Parry facility that has been created now to provide greater storage. You look at the transformation in agriculture that we have seen. The transformation in housing, where housing is being built all across this island, with developments now in Hamilton, Craddock Road, Maddens, developments up at University Heights, developments planned for Rice's, and for me, right in my constituency there, just above Cherry Gardens. This individual, I think, has contributed and continues to contribute. And he has my support because he has shown by his effort that he is committed to serving the people of St. James, the people of Nevis, and the wider Federation. Honorable Alexis Jeffers, if you're listening, congratulations on 10 good years of service. And may God bless you with long life and good health, that you will continue to serve the people of St. James and our beloved island and country. I have no doubt in my mind that St. James will deliver for you, because you have and continue to deliver for them. And that ultimately is what politics is about, demonstrating to our people that we are committed to them and that we're here to serve them. And so I could not let this show end without saying congratulations to you and happy anniversary. 10 years is indeed a milestone in the life of any elected politician, and you have done it successfully. Before I close, let me just point out that in every election that the Honorable Alexis Jeffers has run, he has done better. He would have won his first election. He would have run his first election in 2010. Federal, he fell short. In 2011, he won the local election and was elected to the Nevis Island Assembly. When we took it to court and we had another general election in 2013, he won again by a larger majority. 2015, he lost very narrowly the federal election. And in 2017, he won the local even by a bigger margin. In 2020, he did and created history by winning that seat federally for the first time for the Concerned Citizens Movement. That is a remarkable record in a short period of time. And I do believe that God will continue to bless him with good health. And I do believe that with health and strength, he will continue to serve and to serve with distinction. That's our show. The banner struck up. It means we have to go. Thank you for all who called. Thank you again, Dr. Rouse, for your phenomenal generosity of time and spirit to the people of Nevis. We are truly grateful. Thank you. Good night, and God bless you.
Views and opinions expressed on the preceding program were solely those of the participants and do not necessarily reflect the views of the Nevis Broadcasting Company Limited or its advertisers.